I believe it was Voltaire who said, "The art of medicine consists of amusing the patient, while nature cures the disease." And here's another one. Doctors are men who prescribe medicines of which they know little to cure diseases of which they know less, with patients of whom they know nothing. Ladies and gentlemen, I am Dr. Peter Glidden, and this is Fire Your MD Now. One more quote. We're rounding it off this afternoon, with a trifecta. Winston Churchill. Men occasionally stumble over the truth, but most of them pick themselves up and hurry off, as if nothing had happened. Well, I couldn't agree more. The job of my job and the job of the majority of my colleagues who have taken up this cause with us is to pull back the curtain on the way that medicine is practiced here in the United States and to fulfill our oaths as educators. Because when you look up the root word of doctor in Latin, docere, means teacher. Most doctors need to teach more. All doctors need to teach more. But quite frankly, it's the naturopathic physicians, the holistic physicians, who are the only ones in this country who are trained in medical nutrition. Your MD, drug doctor, is only trained in drugs and surgery. That's all that they know. So that's the only advice that they can offer you, is about drugs and surgery. And this is why the leading cause of death in the United States is drugs and surgery. Because the majority of chronic illnesses which afflict humankind cause human suffering. Things like high blood pressure, osteoporosis, arthritis, high blood pressure, I already said that, fibromyalgia, type 2 diabetes, insomnia, anxiety and panic attacks, heartburn. All of these things have their roots in multiple nutrient deficiencies. But your medical doctor, having no training in nutrition, doesn't know this. Therefore, it is impossible. It's not just difficult, it's impossible for your MD to help you recover from chronic disease. They can't do it. So stop giving them money. Stop feeding the beast. Stop supporting a medical system that fails to produce results. Stop supporting a medical system which is the cause of autism being 1 out of 88 births now. 1 out of 88. Stop feeding the system, which is the cause of Alzheimer's, rising from obscurity to the 6th leading cause of death. Stop feeding the medical system that has completely been unable to find any positive therapy for cancer in the last 100 years. Stop feeding the system, which has failed to produce any noticeable change in the occurrence of heart disease. Stop it. Stop feeding the system, which is the cause of the obesity epidemic. Stop feeding the system, which is the cause of lower lifespans. Stop feeding the system, which is the cause of bankruptcy. Stop it. Just stop doing it. The only way. Medical system in the United States is the Titanic, and it is going down. And medical doctors are jumping off this ship like rats jumping off the Titanic. They know that it's going down. It's only a matter of time. The insurance companies are trying to squeeze as much money out of you as they possibly can before the ultimate end of the road happens. We cannot sustain. This medical system cannot sustain itself financially. And the reason that it cannot sustain itself financially is because the therapeutics that the MDs deliver don't work. They don't work. The only thing they're good for is acute disease. That's it. You know, you've got a 3rd-degree burn. You've got a bullet in your arm. You broke your leg skiing. You're in a car accident. Cracked your head open. You got a bleeding artery. Got your leg blown off in Iraq. They're good at fixing that. They're excellent at it, quite frankly. But not all the time. Because according to Harvard University, 51% of emergency room medical doctors are addicted to street drugs, prescription drugs, or alcohol. So if you're unlucky enough to be transported to the ER, have your doctor drug tested before you let him near you with a scalpel. That's my advice. And hang it up. Forget it. Cancel your comprehensive medical insurance. Stop paying it. You're going to get so sick, you won't be able to afford it, right? That's what medical insurance is. You're betting you're going to get so sick, your bills are going to be so expensive that you have to guard against that now. You have to guard against, have to put money away for that knee replacement surgery that you know is on the horizon. You have to put money away for that expensive chemotherapy that doesn't work, that you can feel is on the horizon. You have to put money away to, oh my God, what happens if I break my leg? What am I going to do? What happens if I get pneumonia? Oh my God. Well, you know, you're right. Because an average stay in a hospital now is, what, $5,000, $10,000 a day? You've got to be kidding me. And we put up with it. And irony of ironies, one of the easiest things in the world to do is to help your body secure its health. All you have to do is stop eating the bad food, start eating the good food, lean on the doctors who know the difference between bad food and good food. That would be me. Take your vitamins, take your nutritional supplements every day according to body weight, and you will be healthy. That's a much better allocation of funds than medical insurance is. You got to be kidding me. Why on earth would you pay hard-earned money to gain access to a system of medicine that's the leading cause of death in the United States? Snap out of it. Swallow the blue pill. Pop out of the matrix. Take a look around. It's bad. And it's not going to get any worse. Your doctor is incapable of helping you regain your health. They cannot do it. Not your medical doctor, not your MD, not your drug doctor, not the shill to the pharmaceutical industry that your MD has turned into. And I am choosing my words carefully. My words are based on 23 years of clinical experience in the front lines, seeing the damage that the MD-directed medical therapeutics have afflicted on humankind. And I'm the only one standing up and saying anything about it. Well, I'm not the only one. Dr. Wallach of Dead Doctors Don't Lie fame, my mentor, came before me. I am the second witness to Dr. Wallach. And let me tell you something. Since I've been following Wallach's lead, since I've been using Dr. Wallach's therapeutics, using the Longevity family of supplements in the way that Dr. Wallach recommends them, since I have been looking at the world of illness through the lens that Dr. Wallach developed, since I have been paying attention to disease as it manifests via the mechanism of nutrient deficiencies, my life has been completely changed. The things that I've seen people recover from while I've been with Dr. Wallach are unbelievably extraordinary. If you'd seen half the things, if you'd seen a tenth of the things that I've seen, you'd be calling this radio station, you'd be lined up. You'd be sleeping outside the radio station the night before to gain access to this information. That's how life-changing it is. This is a revolutionary idea, ladies and gentlemen. It's actually an old-fashioned, old-as-time idea that is slowly starting to force itself up through the pavement of the pharmaceutical industry. And we got a little sprout coming up here. We got a little sprout coming up here. Before you know it, we're going to make the entire asphalt crack. And it's going to become one green roadway again. And I'm not talking about green, save the planet green. I'm talking about green, your body can fix itself. This is our fundamental message. The human body has the ability to fix itself, period. Your medical doctor does not believe this. Your MD is trained to believe that once you're sick, you're screwed. And the best possible thing you can do is manage the pain until it gets so bad that you have to cut the offending tissue out. So you got to take out the gallbladder, take out the stomach, take out the kidney, take out the lung, take out the small intestine, take out the large intestine. Heck, why not take out the rectum while you're at it? And while we're doing that, why don't we cut the breasts off preventively? Why don't we just yank the prostate out? Why don't we remove the uterus and the ovaries preventively? Because, you know, that's one way to avoid uterine cancer. Well, if there was a rash of hand psoriasis in this country and millions of people were getting hand psoriasis, preventing them from going to work, I guess one way to solve it would be by cutting off your hands. That's the MD way. That's the reductionistic way. That's the old-fashioned way. That's the only way that your doctor knows. And your doctor has gone out of his way to tell you that I'm a quack. even though the only people selling snake oil in this country have MD after their name. You know how I know that? Just look at the class action suits that there are right now. There are 30, 40, 50 class action suits now against drugs that were approved by the FDA, drugs that hurt people. And they were approved by the FDA. They were sold to you as safe and effective. And you paid through the nose for them, and they hurt you. That's the very definition of snake oil. As God is my witness, the only people selling snake oil in this country have MD after their name, and it is my advice you stop giving them your money. Call your insurance carrier today and say, I want a catastrophic insurance policy. I want something that's going to cover me in the case of a traumatic injury to my body, period. That's it. And use the money that you save in a reduced monthly medical insurance premium to buy your nutritional supplements. And yes, let me make it abundantly clear, I am telling you to purchase nutritional supplements. That is the deal. I want you to buy nutritional supplements. Yes, I am selling nutritional supplements. And you should listen to my advice. Because in order to survive on planet Earth, you need nutritional supplements. If you think you can get all the nutrients you need from your food, it's a fool's errand, and you will die young. But before you die, you will suffer, and then you'll die. And your knucklehead MD will write it all off to genetics. You've got to be kidding me. We're going to talk about vitamin quality control in the next part of this segment, ladies and gentlemen, because, like the fella said, it ain't what you don't know that'll hurt you. It's what you know for sure that just ain't so. I'm Dr. Peter Glidden. This is Fire Your MD Now. Now, if you had a bad tooth, if you had an infection in a tooth and it was hurting and you're in pain, what are you going to do? Are you going to search the internet? Are you going to research it yourself and find out how to fill that cavity? Are you going to buy the dental equipment and perform the surgery on yourself? Are you going to do all that? No. But if you have high blood pressure or type 2 diabetes or osteoporosis, or you want to try to figure out how to lose weight, most then you're frustrated with conventional medicine. Right? You know, you've been to the drug doctor, you've been to the pharmaceutical doctor, and you know that it doesn't work. It just made you worse. Now you got to do something. What are you going to do? Well, here's what most people do. They'll search the internet, and they'll try to figure it out themselves, and they'll read the information they'll collect all the information that they can of everybody on the internet. And you'll get one person to tell you to do this, you'll get another person to tell you to do exactly the opposite, and everybody's selling something. By the time you know it, you are lost. Well, there's another option. Just like going to the dentist. If you had a bad tooth, you go to the dentist. You go to someone who's trained in that, right? A trained professional with experience. Someone who has a track record. Someone who's licensed. Someone who you can trust. Someone who's been vetted by at least one fraction of the society, right? And you go to that person and they fill the cavity. You know, or drill out the infection, give you a sedative, fill the cavity, life is good. We move on. Well, that's what you need to do when you're frustrated with your health and you're over the MDs. You got to do something. Instead of trying to figure it out yourself, go to the professional. And who's the professional? The professional is the licensed naturopathic physician. Because we're the only physicians in the country that are educated in science-based, clinically verified alternatives to drugs and surgery. We're the only people that have been applying these therapeutics for decades. We are your go-to people for all things non-drug. That's our domain. That's what we do. The problem that we have here is there's less than 4,000 of us in the whole country. And of those 4,000, there's probably around 300, maybe, that have more than 20 years of clinical experience, and I'm one of them. My colleague, Dr. Wallach, is another. Together, we have a combined 50 years of cumulative clinical experience, and this is the horse that you should bet on. You should bet on us. You should take your health concerns to us, because we are the people with the clinical experience. We are the people with the clinical know-how. We are the licensed physicians who are trained in this stuff. You can trust some guy on the internet, or you can go to the professional. And guess what? If you come to see me by way of this radio program, there's no consultation charge. There's no insurance copay. There's no nothing. We don't charge you anything for the information. You tell us what the problem is. We tell you what to take to get better. We'll give you the stuff at the wholesale price. You try it for 30 days. If you don't like it, you send it back, get all your money back. You have nothing to lose. Absolutely nothing to lose. So trust some stranger on the internet. Go right ahead. Some guy who's read a book about vitamin C. Trained professionals. And if you come to us via this radio show, we'll charge you an office visit fee. We've got it all set up for you. You tell us what your problem is. We tell you the science-based, clinically verified therapeutic that supports and promotes the health of your blood, supports and promotes the health of your blood sugar, supports and promotes the health of your joints, supports and promotes the health of your heart, supports and promotes the health of your liver, your kidneys, your lungs, etc., etc., etc. Lean on us, ladies and gentlemen. Lean on me. I am your go-to person for everything having to do with clinically verified, science-based, safe and effective alternative medicine, or rather, I'd like to say holistic medicine, because this medicine is not alternative to my patients. It's primary to my patients and my clients. I am Dr. Peter Glidden. This is Fire Your MD Now. You want to talk to me today? Give us a call. 866-582-9933. That's 866-582-9933. I'll be taking your calls and talking about weight loss. We talked about it last week. I'm going to just underline it once more today because it's important. Weight gain is your doctor's fault. The reason that you have a problem with weight is because you have gone to the wrong doctor, period. Weight gain is a deficiency disease. Your doctor does not know this. The only thing that makes people gain weight is we eat too many calories. There was nobody in Auschwitz that was overweight, right? If you don't eat, you lose weight. There's only one thing that makes people eat too much: lack of nutrition. Your body has wisdom. Your MD is blind to this. When your body is running on nutrient fumes, it knows it. It has smarts. Your body has street smarts. It knows it's running on nutrient fumes. It knows it's running on 1/8 of a tank. So what does it do? Well, your brain and your central nervous system force you to eat in the desperate attempt to fill the tank up. So what do? You go to Olive Garden, eat 3,000 calories of food, but the food that you're eating doesn't have the nutrients that you need in it. So 2 hours later, you're hungry again. So you eat and 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 you eat, and your doctor tells you you're depressed. Your doctor tells you you're lazy. Your doctor tells you you need to exercise more. Your doctor tells you you need to have a smaller stomach. Your doctor tells you needs to cut out half of your stomach. Your doctor tells you needs to put a lap band around your stomach. Your doctor tells you you need to take stimulants. Tells you need to take Prozac to deal with your mood swings. Your doctor tells you need to take Klonopin because it's all in your head. And guess what? It's not your fault. It's your doctor's fault. The only reason that your body craves calories over and over and over again is because you are running on nutrient fumes. And your body knows it. It's smart enough to know it. Your body is smarter than your MD. How about giving your body money every month instead of giving your MD money every month? How about that? There's a turn of the cards. Let's all do that. Start giving that money to ourselves rather than our MD, rather than our health insurance company. I'm all for that. Now, here's what you do. You go to fireyourmdnow.com. Click on the vitamins and nutritional stuff. Click on the online store button. Follow the link to the vitamins and nutritional supplements and purchase one healthy start pack per 100 pounds of body weight per month. So if you're 200 pounds, you need 2 healthy start packs a month. If you're 150 pounds, you start out with 2, and then the next month you buy 1. There's also a document right there that you can download Tells you how to take the stuff, and guess what? The information's free, and I will sell you the products at the wholesale price. That's right. I am telling you to purchase supplements. That's right. I am unabashedly, unashamedly selling you vitamins and nutritional supplements because I took an oath in 1991 to... I am dragging you into the light of medical nutrition because you are suffering with obesity, with high blood pressure, with bad knees, with a bad heart, only because your body has run out of the stuff it needs to keep itself healthy, and you are unwittingly eating all of the wrong foods all of the time because you have bet on the wrong horse. You talked to an MD about nutrition. That's like talking to your plumber about how to fix your computer. That's like taking a chihuahua on a pheasant hunt. It's the wrong dog for the job. No wonder we get such poor results. No wonder MD-directed therapeutics are the leading cause of death in the United States. No wonder this generation, according to the United States Department of Health and Human Services, will be the youngest generation, the shortest-lived generation in 100 years. And we put up with it. You know, why aren't we marching in front of the hospital saying, just say no to the MD? Why aren't we picketing in front of a Pfizer pharmaceutical? Just say no to drugs. Well, for goodness sake, where's Nancy Reagan when you need her? We've all gone down the rabbit hole together, and it is my job to pull you all out of it one at a time. And more appropriately, to help you educate yourself about this so that you can help me and pull your neighbors out, because this is too big of a job for one guy. It's too big of a job for two guys. It's too big of a job for 100 or 1,000 guys. We need an army. We need an army, a coalition of the informed. People who see the light of medical nutrition. People who try our projects on for size. Try our protocols on for size. Take a walk outside of your comfort zone. Just say no to drugs. Just say yes to life, to medical nutrition, to 90 for life. That's what we call this program, 90 for life. 90 essential nutrients for your life, for life. You need your essential nutrients every day, the same way you need water and food and shelter every day. You need to take this stuff every day for the rest of your life. And if you don't, your body's going to run out of something, something's going to break. If you do, you will maximize your lifespan. You know, there are cultures around the world, they're called blue zone cultures. Some knucklehead from Harvard University researched this, couldn't figure out why these people were living so long, must be genetic. Wrote a book about it, and the term that he coined is the blue zone. So the cultures like the Hunza people in Afghanistan, the Bama people in southwest China, the Okinawans in extremely southern Japan, the Georgians in Russia, the Vilcabambas in Peru before they were killed off by Western medicine. These cultures, members of their culture lived to be over 100. 1 out of 250 of them were over 100, and they were healthy. In the United States, it's 1 out of 10,000. And in the third world countries, in the blue zone cultures, these people were over 100 years old. They didn't have Walgreens. They didn't have pharmacies. They didn't have medical insurance. They didn't have hospitals. They didn't have doctors. They're lucky if they had a roof over their head. They didn't even have 3 square meals a day. And they were over 100 and healthy. In the U.S., it's 1 out of 10,000. When we're over 100 in the U.S., we're sitting in wheelchairs drooling. Can't remember the names of our kids. Oh, the golden years. We've got no hair. We can't hear. We can't see. We've got fake teeth. We've got 4 fused vertebrae. We've got no gallbladder. We've got 1 kidney. We've got 4 fake knees. We need a prescription medicine to pee, a prescription medicine not to pee. The golden years. You've got to be kidding me. Brought to you by Bus Driver MD, by Medical Director MD, brought to you by Big Pharma. Snap out of it. For goodness sake, what's it going to take? Well, I'm going to tell you what it's going to take. It's going to take vitamins, minerals, essential fatty acids, and amino acids. That's what you need. There are 91 essential nutrients. Now, years ago, when Dr. Wallach was figuring all this out, he was in charge of $25 million of federally funded research. $25 million bucks. They did 26,000 autopsies, 10 million blood chemistries. It was a gigantic research effort, which resulted in the publication, which is now in the Smithsonian. It's called The Diseases of Exotic Animals. That research eliminated 900 diseases in the animal kingdom, 900. It's the reason that bacon and eggs doesn't cost $200. Because the pigs and the chickens and the turkeys and the cows don't get arthritis, they don't get fibromyalgia, they don't get congestive heart failure, they don't get depression, they don't get insomnia, they don't get high blood pressure. Why? Because those animals are getting all of their nutrition every day from the person that's raising them, because the person that's raising them got a clue. Looked at the research that Wallach did 30 years ago and started giving their animals all of the nutrients that that animal needs every day. Your dog is more nutrified than you are. I want you to think about that. Your dog has better state of health than you do. For goodness sake, look at the ingredients on the dog food. It's a cornucopia of vitamins and minerals. But you get none. You get hardly any. And you're eating fried food every day. Fried food is loaded with acrylamide. Acrylamide is carcinogenic. Well done red meat and the skins of baked potatoes, yams, and sweet potatoes are loaded with a chemical called a heterocyclic amine, which is carcinogenic. You eat that stuff down all the time. Nitrates added as preservatives to meat when heated turn into a chemical called nitrosamines, which are carcinogenic. So let me get this straight. When you eat fried food, well done red meat, pepperoni, deli ham, deli turkey, you're pouring carcinogenic chemicals into your body. And I wonder why we've lost the war on cancer. It must be genetic, right? Wheat, barley, rye, and oats are 4 of the worst foods anybody can eat. Wheat, barley, rye, and oats will kill you. Wheat, barley, rye, and oats contain proteins which are almost impossible for your stomach to digest. Well, that's right, oatmeal. By the way, it's not Old Testament wheat. It's Monsanto's monoclonally hybridized wheat. There's a great deal of difference. When you eat that crap, your stomach can't digest the protein. So when you get an undigested protein tumbling through your small intestine, it destroys tissue, which leads to ulcerative colitis, Crohn's disease, inflammatory bowel disease, etc., irritable bowel, and it gums up the villi in the small intestine, which absorbs nutrients. So the more whole grains you eat, the harder it is for your body to absorb nutrition, and that's why Michael Jackson died at 51 years old, 52, whatever it was. We were born in the same year. I'm 53 years old. Michael Jackson died because he'd been eating whole grains for the last 20 years on the advice of his nutritionist who didn't know squat about health care. Michael Jackson's system was so damaged by the proteins from wheat, barley, rye, and oats. His intestinal tract was so far gone he couldn't even absorb pain medication. They had to inject it into him. And I'm the quack. You've got to be kidding me. Ladies and gentlemen, everything that you eat is bad for you. But I have good news. Dr. Glidden wants you to eat butter. Yes, butter. I want you to eat salt. Yes, salt. Salt your food until it tastes good. I want you to eat full-fat milk, full-fat dairy, full-fat cheese, full-fat yogurt. Fat does not make you fat. Lack of nutrition makes you fat. I want you to eat rare meat as much as you want. Poultry, turkey, fish, rice and beans, fruits, vegetables, lard, red wine, coffee and tea. We're okay with all of this. Eat like the French, except just don't use the bread. The French are the second healthiest nation in the world. Imagine that. Butter and cream and salt and spices. My colleague, Dr. Wallach, says, can you imagine a French chef cooking with margarine? Forget it. It's not going to happen. Salt and the real stuff. Cream. Whole milk. We've gotten so far away from the truth because we've taken the wrong dog for the hunt. Bring it back, ladies and gentlemen. You can dial your health in. You can. Clean your diet up. 9 foods we advise everybody to stop eating, and you can download that list for free at fireyourmdnow.com. Just go there, download the list for free, and then click on the online store button and get yourself one Healthy Start pack plus one bottle of liquid plant minerals. That's my recommendation. One Healthy Start pack plus one bottle of liquid plant minerals per 100 pounds of body weight per month. Take those supplements every day, and when you do, it will be the first time in your life your body has been completely nutrified, and that is a game changer. Now, when my colleague, Dr. Wallach, was working for Yerkes Primate Research Center in Atlanta, Georgia, this was during the 12-year stint of his $25 million research project, he discovered the cause and the cure for cystic fibrosis. He also discovered that cystic fibrosis could cross species lines, and it could happen in monkeys as well as in humans. Before Dr. Wallach's research, it was assumed that cystic fibrosis was a humans-only disease. Well, he blew that myth right out of the water. And he also showed that cystic fibrosis was caused by not enough of the mineral selenium in the blood of a pregnant monkey or human. Selenium was the key nutrient in preventing cystic fibrosis from happening. This was a revolutionary breakthrough. Selenium, a naturally occurring mineral like calcium, a deficiency in the mineral selenium was the cause of cystic fibrosis. Imagine that. And for that breathtaking gift to humanity, Yerkes Primate Research Center fired Dr. Wallach. And every major medical hospital blackballed him. Because the NIH called people up and said, look, if you hire Wallach, we're going to pull your funding. Why is this? Because medicine is a for-profit industry in the United States. And when you cure something, all the research money dries up, number one. And number two, there ain't no money in selenium because it's a naturally occurring substance and nobody can patent that. You can't patent oxygen or orange juice or buttercups. It's a naturally occurring substance. So since anybody could make it, why make a big deal of this? Why take this a step forward further and bring it into headline news? Well, they wouldn't, and they didn't, and that was 33 years ago. Now, just last November, 33 years later, Dr. Wallach was awarded the Klaus Schwartz Commemorative Medal for his work on cystic fibrosis 30 years ago. Look it up. Klaus Schwartz. Look up Klaus Schwartz Commemorative Medal on the internet and you'll see what I'm talking about. When Yerkes fired Dr. Wallach for finding the cause and the cure for cystic fibrosis, it opened his eyes because he understood that the front door of medicine is guarded by the pharmaceutical industry. Now, there is no way that he can get his message of health recovery through medical nutrition through normal scientific channels, because there are no such thing as normal scientific channels anymore. It's all big pharma all the time. So in order to save humanity, Dr. Wallach decided on purpose to set his company, Youngevity, to set it up as a network business. He could have sold his vitamins online. He could have sold his vitamins through the home shopping network like Andrew Lessing. He could have developed a direct-to-physician only line of nutraceuticals. He could have sold all his stuff at GNC, but he did not. He chose on purpose to disseminate his information about health recovery through medical nutrition through a grassroots coalition, because the front door of medicine is guarded by the pharmaceutical industry. So we are growing through the back door with your help. There are thousands of people all over this country, just like you, who've said no more, enough is enough. I am taking back my health. I am taking back my health today, and they have joined us. They have joined our coalition, learned Dr. Wallach's health recovery methods because they're easy. If you can pass a driver's license test, you can figure out how to do this stuff. There's no big learning curve here. And, you know, we need your help. There's two ways you can work with us, folks. Just tell us your health problems. We'll tell you Dr. Wallach's health recovery protocols for free, and we'll get you the nutritional supplements at the wholesale price. But if you want to make a difference in your world and make some money to boot, join us. We're looking for people to help us change the world, because the world is in desperate need of help. Ladies and gentlemen, tune in tomorrow. We're going to be talking about osteoporosis, osteopenia, and why the last person you should trust with your health is Sally Field. I'm Dr. Peter Glidden. This is Fire Your MD Now. Check us out on the web, fireyourmdnow.com. I'll see you tomorrow, same bat time, same bat channel. Dr. Glidden, over and out.